Hello, my name is Carolina Paranto. I am an LPN to BSN student at Indiana State University. Here is my presentation on Medicare age adults in Wyoming. Our learning objectives for this presentation are: at the end of the presentation, the viewer will be able to classify a population at risk and how an individual 65 years or older fits into this category. At the end of the video, the viewer will be able to explain how to use ethical principles when using patient care technology in the community. At the conclusion of this presentation, the viewer will be able to identify how to show accountability in legal decision-making in community settings. And at the conclusion of the presentation, the viewer will be able to identify how to show accountability in ethical decision-making in community settings. At this time, if you pause the video, there is a pre-test. If you could please complete that, as well as take a brief look at the handout that accompanies this presentation. Population at risk for this presentation is older adults over 65 years old in Wyoming, as well as other sparsely populated communities where patients are more spread out and have harder times getting to a physician, especially an older adult who may have transportation issues, may have issues with seeing, as well as more chronic issues that need to be addressed with the provider on a shorter time frame, such as older adults who are more prone to chronic illnesses and degeneration of the body. A population at risk is also noted to be a population that is at a higher risk for chronic illnesses and for adverse health outcomes, and older adults are part of both of those demographics. According to the United States Census, the population per square mile in Wyoming is 5.8, which is 5.8 people per square mile. According to the United Health Foundation, the poverty level in Wyoming is 11%, which affects those in rural areas, or as noted before, in populations that are more sparsely populated. There are 32.7% of the population volunteers, which is very important because a good third of the population is willing to volunteer to help, possibly with transportation for these patients, as well as helping with their healthcare needs. In Wyoming, there are 221.3 primary care providers for every 100,000 people in the state. Primary care providers are classified as internal medicine providers, OBGYN, pediatric, and geriatric providers. So it's important to note that these primary care providers may not take patients who are older or too young or who do not need OBGYN appointments. It is also important to note that this ratio means that approximately 452 patients are noted for every primary care provider, which causes issues when taking into account older populations with chronic illnesses who are at higher risk for needing to follow up with a provider in shorter time frames, such as monthly or every 3 months for medication refills and for chronic illness follow-up. Wyoming is ranked 45th in overall clinical care. It is also ranked 48th in preventative clinical services. There have been 3,300 preventable hospitalizations in 2020, and older adults age 65 and older are at 12 times greater rate than older adults to have preventable hospitalizations. Taking into account the overall clinical care rank as well as the poor rank in preventable clinical services, and the high amount of patient to physician ratios, it shows that there are a lot of patients who may not be getting the care that they need, especially in a place that is more sparsely populated and the patient has a harder time getting to a physician. So what can be done legally and ethically to help these patients? Well, for a patient who is of Medicare age, there can be policy changes for older adults in Social Security and Medicare. Programs to help patients in rural areas can help to provide more money to these patients so that they are able to get the resources that they need to follow up with a physician. This would improve access to physicians, and some ways we can improve access to physicians is by providing more resources to the physicians themselves, in improving technology and helping with getting resources for telemedicine visits, home visits to the patients when they're having more severe issues that a physician needs to physically see the patient. Ride-sharing vouchers are helpful to get a patient to a physician's office, as well as public transportation, and volunteer vehicle programs that have patients utilizing volunteers who will take them to doctor's appointments. One thing that we can do is work towards affordable housing and affordable durable medical equipment. Patients with situations and illnesses such as COPD who may need oxygen tanks, portable oxygen tanks may be better for that patient, but due to healthcare costs, they may only qualify for larger oxygen tanks, which make it harder for them to get around. So working towards more affordable, durable medical equipment, affordable housing helps the patient utilize the resources that they personally and financially have to get to doctor's office visits and have a healthier lifestyle. Another thing we can do is work towards having nutrient-dense food vouchers and delivery, so patients aren't eating lower cost foods which may not be helpful for their health. Technology in the community can be to see how to ethically use technology in the community. Well, first and foremost, it's always important to verify HIPAA, making sure that you have the patient's name, date of birth, or other forms of personal identification, especially when using telemedicine and phone conferences. Routine home visits, always make sure that you're using HIPAA verification and making sure that you have the right patient. Using passwords in technology is important so others are not able to get into any computers that are being used. Also, multiple verification is important because that way there may be multiple things that need to be completed to get into a patient's chart. Making sure there's no patient identifiers or any trend reports for community nurses who are following any trends. Phone applications need to be secure so that if a patient decides to text a physician through a portal or send an email, that their information is not getting leaked elsewhere. And phone applications to help with medications and symptoms, reminders of what to look for when taking a medication or when having a healthcare chronic illness, or when to take their medications. Those things should also be password protected, so not everybody knows the patient's personal medical history if the patient does not choose to have that information be known. At this time, if you will pause the video and take the post test. Once you are done, I will put up the answers for the post test. Okay, here are the answers. And here are the references that were used to get the information for this presentation. Thank you very much, and don't forget to take a look at the handout that accompanies this video. Have a wonderful day.